Don't believe the hype. Don't believe the hype. Don't.
Good evening and welcome to the Don't Believe the Hype Show. I'm Valerie Kelso and we have got another special guest, but as you can see we've got a new setup. Yes, this is what I've been working on for the last week. And yes, we're going to get our sign put back up, but the gentleman didn't quite get it finished. But hopefully it will be done by the end of our program and you'll be able to see our new sign. If anybody would like to come onto our show, you are welcome to come onto our show. There's no charge. Everything that we do here at the Purple Light Touch Foundation, it's all free. If anybody would like to donate or sponsor, we are welcome. We would love for you to be able to donate if you want to sponsor. If you even want to share your ad on our show, we will also charge a small amount of money because everything that we make here goes right back into the foundation. So you can give us an ad that you would like us to run across our show and we will gladly do that for you. So once again, this is the Don't Believe the Hype Show and I'm Valerie Kelso, and today we have got another special and amazing guest, Miss Deidra Kindred.
Hi.
Did I get it right?
Yes, you did.
As you all know, I'm the person that butchers everybody's name. So I'm glad I got somebody else's name right. I think 2 out of probably 30 shows, I'm getting there.
All right.
Right. So Miss Deidra, tell us a little bit about yourself and tell the audience what you do.
Well, great. Thank you. So first of all, I'm so appreciative to be here with you, Valerie. You are an amazing woman. And my name is Deidra Kindred. I've been a nurse for about 25 years. My background is cardiovascular intensive care, med-surg intensive care, CCU, anything with ICU behind it for adults. I used to joke and say I'm a heart, lung, and kidney nurse because nurses specialize. So I just want everybody to know a nurse is not a nurse is not a nurse. So I am so happy to be here, and I've always been an entrepreneur. Entrepreneurship is in my blood. And so now I am the proud owner of Your Healthcare Nurse Advocates.
So you said entrepreneur's always been in your blood. So either it's got to come from your parents or somebody very close to you.
Yes.
So tell us a little bit about who inspired you to.
Oh, my mother grew up in a single parent home. She was a mother of 4, and she moved us from Michigan to Texas back in '82. So I'm probably older than a lot of people.
Not me.
And I always saw her, she was always doing something. The woman could make furniture.
Okay.
She was a sewer. She sewed all the wedding dresses for my first wedding and all the bridesmaid dresses. She did all the bouquets. She was always innovative, always doing something in addition to being a marketer.
Okay.
So lots of inspiration from her. So in growing up in her home, you had to have a plan A and a plan B.
And so you
And
make sure
plan
you
C.
got an A, B, C,
Yes,
and a
yes.
D. You know what I mean? So how long did you go to nursing school for?
I went to nursing school for 4 years, so I got my bachelor's.
So when did you feel that you wanted to do something different, out of the norm, out of the box? Because your company is not the typical company that you would expect.
You know what? That's a great question because I fought God so long with Him telling me and giving you signs. God gives you signs throughout your life. If you could go back and look back and reflect on certain things that happened in your life, there's everything for a reason. There's things that added up. So number one, I'll share with you this. I did not want to be a nurse. I didn't wake up saying that I want to be a nurse. I wanted to get my CPA in accounting. And I had envisioned me staying in like this corner office and working at this big firm and, you know. But I went to high school and graduated, and then I went to college and I started taking those accounting courses. No offense to you accountants, but hats off, they are boring. They are so boring. And so then, of course, me being the know-it-all 21-year-old at that time, I started skipping class. and partying, and I ended up having my son. That was the light that came on that I had to get serious about life. So I went back to school, raising my son, working a full-time job, and I was going to go to school to get my degree in physical therapy.
Okay.
And so I was minding my own business, everybody, going to school, getting my physical therapy degree, and having to volunteer in a physical therapy clinic, because at that time they were changing it from a bachelor's to a master's, so I was just in that transition there.
Okay.
And they wanted you, before you got accepted, they wanted you to volunteer at like a rehab clinic for a physical therapist and get some recommendations from a physical therapist.
Mhm.
So I'm doing that, and I was taking care of a patient, because I was volunteering at the physical therapy clinic. Taking care of a patient, he said, "Oh my goodness, you would make a good nurse." I'm like, "I'm not gonna be no nurse, I'm gonna be a physical therapist." So go on, 6 months later, I kid you not, different patient, different situation. I was explaining something and the patient said, "You explained that so well, you'll make a great nurse." I ain't gonna be no stinking nurse. You're 21, you think you know everything. These old people are telling you things that you already think you know. Final call, because I believe in confirmation of threes.
Yes.
I'm sitting at home one night. My son put him down to bed, and I'm writing a paper, and I don't remember what class it was, but I got a phone call out of the blue, and he said, "This is Governor Jackson from Texas Women's University, and we would like to offer you a scholarship to go to nursing
Oh,
school.
wow.
All you have to do is write a 750-word essay, have it in my office tomorrow, and we will have you get a scholarship to go to nursing school." So, okay, God.
So, was it somebody that had put your name up to get the scholarship?
I don't know how. I didn't apply for a scholarship. I didn't think about applying for the scholarship. I just got that phone call. It's nothing but God, and I'm getting ready to cry because
No, because
it's nothing but
nobody
God.
don't understand
It's
the
nothing.
amazingness, that the power of God. And
Right,
when He says move, He's
Right.
going to move you.
right.
And people cannot understand, only you. It's like, it's something that's just between you and God. It's,
Mm-hmm,
you know what I mean?
mm-hmm.
You can't describe it to somebody else because they wouldn't believe
Right,
that you out of the blue got a scholarship, because like I just asked you the
Yeah.
question, did somebody put your name up, and you said no.
not that I know
You know what I'm
of.
saying? But God will move us into a
Yes.
position that we don't even realize.
Yes.
Like me doing massages, trust me. The only thing I knew about massages, you remember that song, those bones, those bones, those bones?
Yeah.
And that's as far as I knew about massaging.
Right.
I didn't plan on doing massages, but God knew, He already told me I was going to help people.
He has a plan that's
Yes.
much better than ours.
Mhm.
Yes, so
And
yes.
it's just that we've got to navigate ourselves through His plan
Yes.
and what He really wants for our life.
Absolutely, absolutely.
You know what I'm saying? So
Yeah.
it's so nice that somebody, I feel, God made the governor call you, because why the governor?
Well, his name was Governor. He wasn't
Okay,
a governor.
his name was the governor.
I said, "Governor." He said, "No, my mother named me Governor. It's my
Yeah.
first name."
Oh wow, that's awesome. Makes it even worse. Because that's God said, I'm going to govern to tell you, look, you're going to become
Yeah,
a
make me
nurse.
perk up and listen, right?
You know what I mean? So
Yeah.
yes. So you do a patient independent advocate for
Right.
patients. So tell us a little bit about
Absolutely.
what
So
that entails.
I believe that we all have been advocates for our people that we love. We've
Mhm.
all been that. And what is an independent patient advocate? It is a person that really wants to help fill those gaps in healthcare. So what I saw when I was working in the hospital, I'm going on to my why already.
That's okay.
When I worked in the hospital, when I worked in the CVICU, no offense against nurses who are in the hospital, but you're not an advocate for the clients, the patients. You're an advocate for the hospital because you're limited to what you can tell your patients, and you're also limited on time. And that is so quick in the hospital. So I always felt like you had bypass surgery. That's a life-changing experience.
That's right.
I did not have the time to sit with you and let you know what's the next steps. It's like giving you this discharge packet, follow up with your physicians, and you're looking at me like, well, what's the first step? I couldn't sit there with you
Yes.
because I had to go get the next patient.
Mm-hmm.
Fast paced all the time. And I felt like as a healthcare professional, we are failing people in that realm. We are not really helping you understand and be
That's
able to
right.
know what is next. Who does what, when, where, how? What are the resources? And what really hit home was my number 2 why was my mom. At the age of 52,
Yeah.
she started showing some symptoms of Parkinson's and MS. So both of those 2 disease processes are treated totally different, but they have some of the same symptoms.
Okay.
So it was an 18-month journey going back and forth to the doctors to get a diagnosis.
Yeah.
Because until you get a diagnosis, you don't know how to treat.
That's
So
right.
it was back and forth with procedures, picking mom up. Well, first of all, let me back up. Asking permission to get off work. And being told, oh, you went to the doctor last week, why do you need to go to the doctor this week? And then having to explain to a stranger, that's my supervisor, that was the neurologist, this week is the pulmonologist. I didn't like that, Valerie. I didn't like that at all. It didn't sit well with my spirit. It's like, wow. So she was also diagnosed, they ended up diagnosing her with both.
Mm-hmm.
But also she had asthma where during the winter or the seasonal changes here in Texas, she would have to go into her pulmonologist and get allergy injections. So that's that's doctor number 3.
That's 3 doctors.
So don't forget the poor primary care physician, so that's 4. And she had an oncologist. So she had a neurologist, a gastroenterologist, a pulmonologist, an oncologist, and a primary care doctor. None of them had the time to talk to each other.
That is crazy.
So when you go into a doctor,
That is
first of all, you
crazy.
take off of
Yeah.
work, you go pick mom or dad up, or a sister, brother, loved one, whoever. Then you go and pick them up, get them to the doctor's visit, sit in that doctor's visit, wait on the doctor because they're extremely busy, get into the doctor, and they're maybe with you maybe 5 minutes tops, and then they're out. Questions, concerns,
Yep.
just get forgotten, or nobody addresses that, or nobody knows what to ask, unless you have a nurse going to that doctor's visit with you. And I guarantee you the doctor's visits go differently when you have a nurse with you. So that was reason number 2.
So why does the visit become different if you got a nurse?
Oh, because it's a whole different language. It's like if I were to go to attorney's office and sit there, their legace is different. I'm also a legal nurse consultant too, but I'm just
Okay.
using that as an example.
Yes.
But if I were to go to there, it's like, what did he just say? You
That's
know?
right.
So lots of times, people, number one, you're nervous when you go to a doctor.
And you forget what you're going there for.
Exactly, exactly. So I noticed that when I went to the doctor visit with my mom, when I was allowed to go,
Yeah.
because my job let me off, how nice of them. But anyway, you can tell I'm not a good employee. Anywho, I would be able to ask the doctor, okay, so what's next? Or when he would just prescribe a certain medication, oh no, she's allergic to that. This is what happened when she had that allergic reaction. Let's try this instead of that. Not many people are going to know what to ask. Or why do we even have to jump to a medication first? Why don't we implement some other lifestyle changes
Yes.
for about 3 months? So it's just whatever the patient wants to do. And nobody is helping people have their own voice. So that's why your healthcare nurse advocates came into fruition. And that's another story because I had some accountability partners. I like to thank them for pushing me to do this business.
So who needs an advocate?
I think everybody does. I think everybody does. And this is a new and cutting edge industry. So like I said before, everybody has been an advocate, but now this is becoming a industry. So this industry has been around for maybe about 10 years and
Yes.
not many people know about it. So I feel like everybody needs an advocate. If you can afford an advocate, we can teach you how to be your own advocate or get you a partner to be your
See,
advocate.
that's what I like, even when I'm doing massages and I tell the people, if you don't ask the right questions, you go to the doctors, and if the doctors tell you this is so, you're going to believe, but you're not going to stop and think, maybe if I just turn my hand a little bit, that pain will disappear.
Yeah.
You know what I mean? Maybe
Yeah.
if I just get a good massage, I can release somebody's sciatica, because people
Yeah.
first think, let's jump to the doctors because the doctors are always right. But that doctor, like you're saying, has only got like 5 minutes.
Yeah.
And he's not really looking at your body, he's not feeling the pain in your hand.
Right.
It's for you to tell him, and he'll just say, oh, take this pill because it worked for Joe Bloggs, it will work for you.
Yeah.
You know what I'm saying? And that's why I'm trying to get people to understand, even getting a massage, how important it is. So you setting up this your own company. So when did you decide that you wanted to start your own business, doing what you're doing?
Well, I was really pushed because, like I said before, I'm hard-headed.
Yes.
And God had to give me different signs. So I used to be one of the lead organizers for 1 Million Cups, which is a wonderful organization. And they were going to have startup weekend here in Fort Worth. And so I was going to volunteer to sign people in because I love entrepreneurship. I love being around like-minded, positive people. And my accountability partners were like, no, you're not signing people in, you're going to pitch. And I'm like, oh no, I'm not ready. They were like, yes you are, Darlisa Dilts.
She's calling you out.
Yes, I'm calling her out because I just so appreciate her. You know, accountability partners are really
See, those
important.
are things that I need even for my own self,
Yes.
is to get some accountability partners.
Well, come on, girl.
You know what I'm saying? Because I did come to that 100 cups.
Yes, 1 million.
I think one time,
Yes.
and that was it.
Yes.
Well, that was when I was really going through
Right.
my own
Right,
issues. But right
absolutely.
now, I'm ready to find. I really need some good mentors, and I do need people
Yeah.
to come around.
You have to guard your circle. You
Yes.
have to create that circle with like-minded people, and you have to guard that circle. You know.
So you know what I mean. So when did you start your business?
I started in September 2019, and in healthcare, nobody wants to talk about anything between September and December because they're focused on holidays,
Yes.
family, holidays, shopping, festivities, food.
That's right.
And so in my little mind, I said, okay, I really launched it in January 2020. And guess what happened in March of 2020?
Trust me. Even for me to still be here, I know it has got to be God.
Yes.
Because as soon as
Yes.
I moved into this building, as soon as I got all everything together, then it said, oh, you gotta,
Yes.
right? So
Yes.
how did COVID affect your business?
COVID helped me slow down so I could speed up.
Explain.
Yes. So COVID made me sit back and say, what is my vision for this business? It made me sit back and say, okay, let me start investing in myself. Let me get my board certified patient advocate license. Let me continue to build on my certifications and help people in a more broader way, because the more I know, the more I can help people.
That's right.
Right? So that helped me sit back and say, okay, you know what? Let me add some more initials to the back of my name.
So you got
Oh, I didn't put them all on there because
Okay.
it wasn't big enough.
That's me as well. If I had to put all my qualifications and I got, trust me, my back would be
Yes,
bad,
like,
my
okay,
legs would be bad.
So never stop learning. That's my motto.
That's
Never
right.
stop learning. So it helped me just kind of sit back and say, okay, let me sit back and visualize how I want, what is my niche?
Yeah.
How do I want to serve people? What are my services? What is going to be our top services? So, and to be able to say, okay, this is the vision, and now I have a plan to implement that vision. So COVID helped me out a lot, and my heart breaks for those people who lost people during
Yes.
COVID, but COVID woke me up for prioritization. What's important?
To you.
You know,
Yeah.
what's important is at that time with family, is that time to sit down and slow down, because it's certain things that I would always say, oh, I don't have time for that. I love puzzles, right? I love doing puzzles. I love being able to think things through. But it gave me that time to say, okay, you have time to do puzzles. You have time to work out and lose weight. I lost 30 pounds during COVID because it was like, okay, now it's going to make me There's nothing but healthy food on the shelf anyway.
You know what I'm saying?
You know, so let's go ahead and start eating healthy. So my sister that I live with, my other accountability partner, we were like, okay, you know what? We don't like the way we look. We don't like the way we feel. Let's start changing our diet. And so for that first 6 months of COVID, we started really watching what we eat. And then we started implementing exercise regimen, and now we're still doing it to this day. So it's just like COVID helped me.
So how would somebody go about finding your company? You know what I mean? Because while we was talking earlier on, you were saying that now it's growing. It's really growing.
Yes, it is.
So you need to tell the people how they can find you and your company. You know what I'm saying?
Awesome. I want to add one more little thing before when we were talking. Our poor primary care physicians, my heart goes out to them, because when they have a nurse advocate or advocate in the room with them and they're talking to their patient, it helps the collaboration, the talking that goes on, because the patient feels more comfortable to talk and have their voice, and the physician also feels like they're really able to comprehend what he or she is saying. Because once you leave the room, who's implementing those goals? So that's another thing we can talk about. But if you need a patient advocate, I guarantee you we are up and rising. We're going to be a household name in the next 5 to 10 years. You can go to advoconnection.com. You can go to greaternationaladvocates.org, or you can go to the Care Partner Project, or you can go to the Alliance of Professional Health Advocates. So many national organizations that are out there that can help you find an advocate that fits you, fits your needs. Because there are advocates, you don't have to be a nurse to be an advocate. You can just love what you do by navigating insurance or fighting hospital bills or helping veterans. I know so many advocates that can help people. So pick up the phone and get you one.
Because even you mentioning veterans, because to me, we don't see a lot of veterans in England because I'm from England, you understand what I'm saying? But I see a lot more over here. Although my dad was in the Air Force, and my dad left Jamaica, I was born in England, and so I don't see a lot of like veterans. But over here, to me, sometimes it seems like the veterans are the forgotten people.
Oh, yeah.
They're forgotten. It's like you've served your country, now you've got to go out and come back into a world that you don't, because you've seen so much trauma.
Yeah.
You know what I mean?
And the way they're treated is...
Because even when I've been downtown serving the homeless, I see so many of them that are homeless, saying they don't even know which way to go, and they can't get the medication and things like that because they've got PTSD. So how would you go about reaching even veterans who...
Well, I know patient advocates that specialize in that. So my goal is that when someone calls our company, you get a free 30-minute phone consultation. So I can hear your story, I can see where the gaps are. Then after that 30-minute phone consultation, you either walk away with, if you can't afford an advocate, you walk away with services or resources that you can help be guided. Or we can get you with a veteran advocate. Yes, she's a veteran also. I know her very well. She's in San Marcos, so it's all about me making a phone call or getting that person connected. If it's a service that I don't do, I have no problem saying, hey, I know another advocate, or maybe we can try this resource. To me, it's all about helping people.
That's right.
Get to the right resources so they can get the things that they deserve and they need for their healthcare journey. Everybody's different, and everybody should be treated specially. And I just pride myself in that. I want to help you do something, get something somewhere. And there's many other organizations that are non-profit patient advocacy organizations, so for those who can't afford an independent advocate. So there's resources out here.
So there's a cost to what you do with your company?
Yes, ma'am.
Right, so can they get this like on Medicare, Medicaid?
No, insurance does not pay for independent patient advocates.
Okay.
The reason being is because independent patient advocates are not all under the same umbrella, because you get so many different specialties, and also insurance runs medicine. Because you can go to your doctor's visit and he can, or she can say, oh, I want you to take this medication. And your insurance company can say, oh, no, we don't do that. We're not paying for that. So now what? Who's running medicine?
That's right.
You know, so we have advocates that can help you, you know, with your insurance, whatever insurance company it is. We have advocates that specialize in helping you try to navigate that, find out. And there's other resources as well that are out there. People just don't know what they don't know.
That's right, because even I don't, because I'm not from here, there's a lot that I
Yes.
don't know, and I'm still, every day it's like a learning curve.
Right.
So can you explain and tell the audience like some of the services that you provide, because I've got a paper here and it's like a lot of things that you provide, so explain and tell them some of the services that you
awesome.
provide.
So those services are not just one and done, you know. Lots of times my clients, they sign on with me and they're with me for life, because it's always going to be something that's going to happen.
Yes.
You know, you get stabilized and then life happens, right? So some of the services we provide are medication reconciliation. So anytime you get a new medication added by a different physician, you need to have your meds looked at for contraindications or
Yes.
things like that. We help go to doctor's visit. That's my most fun service.
Wow.
Attending that doctor's visit with you, because that collaboration just excites me. Because when you have more than 3 doctors, you need an advocate.
Okay.
If you have a chronic illness, you need an advocate. You know, if you have a loved one who, you know, they don't understand their health care or they live out of state, you need an advocate. So some of our other services incorporate, you know, looking at organizing your medical records. That's another one that I love, because all patient portals are not created equal. All patient portals do not talk to one another. So what if you could build your own medical binder and have that in your hot little hands every time you go to a doctor's visit?
Wow.
You know.
See, people don't think about things like this. I was even looking at you do a home need assessment.
Yes, ma'am. That comes after that 30-minute phone consultation. So after that 30-minute phone consultation, if someone says, yes, we want you to come and talk to us. So that needs assessment is more like a roadmap that I can see the gaps, or I can hear the gaps, and I can help get you guidance to be your own advocate after that needs assessment, or you can hire our company and we can help you be a better advocate for yourself.
And you also organize your hospital. While you said that,
Yes.
this one I was looking at,
Mhm.
explaining when somebody's discharged from the hospital. Because what gets me, the one that gets me that is shocking to me is that they take you out of hospital the Monday, and by Friday they tell you can go back to work. I just can't get my head around
You know,
how quick.
and that's what I mean, that's another reason. So when I was working in the hospital, I always felt like the process is the most hurried process, because they want you to hurry up and get out so they can get their bed filled.
Because you know,
Yeah,
in
I
England,
said it.
right,
Yeah,
that if you're sick, even when I had my hysterectomy, I had to wait 2 weeks. I had a week stay in the hospital. Then when I got home, I wasn't even allowed to lift a kettle for 6 weeks. I wasn't even allowed to pick up a £5 bag of potatoes. I wasn't allowed to put clothes in the washing machine. I wasn't allowed to do a lot of things. And this was within 6 weeks of coming out of the hospital. I had to get people to come in, and if I wanted food, to bring food to me and everything like that, because they believe that you need to get that bed rest. And then after 6 weeks, then you can probably pick up your £5 bag of potatoes and start back onto the road of recovery. They give you 3 months, and you can be off work for that 3 months and still get paid. You see what I'm saying?
Yes, it's
So-
totally different here.
When I hear women say, oh, I've gone back to work,
Yeah.
because they tell you that
Yeah.
you've got to be careful of getting prolapse and
Yes.
other infections that they
Yes.
don't mention when they're sending people
Right.
out of the hospital over here.
Right.
I saw a guy and he said, yeah, I just had open heart surgery, I'm already back at work. I'm thinking, You know what I mean? If it takes you a week, 2 weeks to
Right.
heal a little cut
Right.
on your finger,
Yeah.
how long do you think that big cut in your chest is going to take?
Exactly.
And
So, yes,
so
exactly.
It's
You know.
crazy how
Mhm.
over here it's like you get you in, get you out, get you in, get you out. It's just, I just can't get my
Feels like a
mind.
revolving door,
It
doesn't it?
does.
So the discharge process is so key because you need somebody else there to help listen to hear the things that you don't hear. Because when they're giving you all those instructions of what not to do or what to take or when to take it, you're worried about getting home. You don't care if that hospital bed's been uncomfortable. You want to get home to your own bed, and that's your main focus. But if you have your family member there or somebody, they can help listen to what is being said. And then also when you get home, decipher through that packet of paperwork that they give you. And then how do we plan? Because the next steps are, we gotta notify all your physicians outside of the hospital, because the physicians inside of the hospital don't have time to talk to the physicians outside the hospital. So now it's lining up all those doctor's visits. And it also is, maybe you need a home health company, maybe you need, a home care company. There's a difference. So the care transition managers, which are usually RNs in the hospital, they help you get ready to get those things coordinated, but who's following through to make sure they're getting coordinated, right?
And that's what you do. You make sure everything is. So you know what, people, you need to get in contact with Miss Deidra, because trust me, it's a home health and taking care of your body after you come out of hospital. Absolutely. Is most crucial. Yes, now you've had the surgery, now you've been cut open, it's a healing process. Is going to help you onto that road of recovery. And if you don't get that healing process because you're worrying and you're stressing about doctors and getting here and getting there, and one of the things I've also noticed that she even does transportation. So it's an all-round package, and we need more people to be on board, because you might think it's just Miss Deidra. No, she's got other people that's helping her to navigate through all what she does here.
Absolutely.
So
it takes a village.
It takes a village, and you can call her. She's got a website, she's got everything, and I'm running off this paper so you can see what I'm looking at, because it's a lot. And it was my pleasure to have Miss Deidra on my show today. So Miss Deidra, let me ask you, what does Don't Believe the Hype mean to you?
Don't believe the hype means to me, don't believe the hype. Investigate things. Ask questions, find resources. You never know until you ask. I always tell people there's no stupid question. It really isn't. It really isn't, especially when it comes to healthcare. And Google is not your doctor. But anyway.
I've got to cut on my finger. Let me Google it. Oh, it's telling me that my finger's going to drop off next week. You know what I'm saying? And people start panicking.
Yes.
So yes, Google is not your best friend.
Yes,
it's all right when you want little things, you know what I'm saying? But,
yes.
So you're right. So anything else you want to share?
Yes, I want to share that Don't Believe the Hype is all about investigating, finding out, asking questions, getting the resources, because you never know. And I so appreciate you for bringing me on the show.
Thank you.
It's my pleasure. I'm so passionate about this. I know my purpose. And we are on fire.
And can I ask you one more question?
Yes.
What age group? I know you said adults, but what is adults? Because some people say from 30 to.
Yeah.
What do you classify?
Well, when I look at my clientele, I have as young as 21 up to 95.
Okay.
Yes, because there's no certain chronic illness is an everlasting life-changing pattern.
That's right.
So if you are suffering from chronic illness, and your family is also part of that journey too. So it's not just about just the patient. Lots of times we are looking at the dynamics of the family and having those talks.
That's right.
That need to come to the table. Not fun, but we do that.
So you sit down also with families?
I've sat down with families and yes. Have those conversations that, they want to put off, end of life discussions.
As you can see, Miss Deidra has got purple on, just like the Don't Believe the Hype show. That's why I said I wasn't going to wear purple today, because I know purple is her favourite colour. And as you can see, purple is her favourite colour. So I want to know why she got blonde hair if purple is her favourite colour.
this is my gray.
Is that
This is
natural?
my natural, yeah.
Oh, it is.
Uh-huh.
Oh wow! Did you see that? That's natural. I thought she deliberately dyed it that colour because she wanted to look sexy. But now she's telling me it's natural. Well, it looks beautiful.
Thank you.
It absolutely suits you.
Oh, thank you.
Well, I don't know if I could do these two more.
I've always admired women who, okay, so the first time that I saw a short haircut was in Black Panther. Those women were awesome and beautiful and powerful and it just inspired me. It's like, oh my goodness, I love that look. And it's so easy to take care of. So, yes, I have short hair now.
It looks, nobody's beautiful. Well, Jamisa's got short
Yes,
hair as
she
well.
does.
But
She's beautiful.
hers isn't the same colour as yours because she's not your age yet.
No, she's not my age yet.
Well, you know what I'm saying, but thank you once again for coming on to our show.
Oh, thank
And
you.
if anybody would like to come on and just sit down here and chat with me, I'm open to you coming on, sharing your story, sharing your passion, sharing your why you're doing what you're doing for the community. Once again, I'm Valerie Kelso, and our special guest tonight was Deidra Kindred.
Yes.
So once again, thank you for tuning into the Don't Believe the Hype show, and we will see you again in 2 weeks' time for our next show. Thank you.